Inflammation of the pericardial sac may produce a friction rub. These sounds are high-pitched and scratchy, often containing both a systolic and diastolic component. Listen to a two-component pericardial friction rub. I will start with 3 normal beats and then add the rub. Pericardial friction rubs occur when inflamed visceral and parietal pericardial surfaces rub against each other during 3 phases of the cardiac cycle, namely during atrial contraction, during ventricular systole, and during early diastolic filling. Listen once again to a two-component friction rub. Friction rubs are often heard best with the patient sitting up and leaning forward. Common causes of pericardial friction rubs include viral pericarditis, disseminated lupus, and uremic pericarditis. Listen to a patient with a two-component friction rub. The typical friction rub has 2 components, but 3-component rubs may also be heard, especially in uremic pericarditis. Listen to a 3-component friction rub. I will start with 3 normal beats and then add the rub. Pulmonic ejection murmurs can have a scratchy quality and are sometimes misinterpreted as a friction rub. However, a scratchy sound should not be considered a friction rub unless both a systolic and diastolic component are heard. Listen once again to a 2-component friction rub. Some clinicians believe that pericardial friction rubs are not heard when there is significant fluid in the pericardial sac. However, this is not true since some contact between the visceral and parietal pericardial surfaces is still possible despite large collections of fluid, as shown here. Listen to a 2-component friction rub. Transient pericardial rubs occur in acute myocardial infarction, but they are usually localized to the area of inflamed myocardium. These rubs may last only a few hours. In summary, pericardial friction rubs occur as a result of contact between inflamed pericardial surfaces. These sounds usually have 2 components and reflect motion of the heart relative to the pericardial sac. Listen once again to a 2-component pericardial friction rub.